healthcare facility, including insufficient wards to accommodate patients. That is what prompted the management of the hospital to refurbish and commission Ward 5, which has been unused for some period of time. Healthcare manager Dr. Ibrahim Makapua stated that the hospital was constrained with sufficient space to admit patients, hence the need to create more space for patients.
Well, the situation was very dire, as we say. The ward was not up to standard, and it was very much dilapidated. So in fact, that was why I decided with the management to lock it up. We closed it temporarily so that patients will not use it, even though we are constrained with space, but we want to make sure we give our patients the best. So that was why we decided to close it for the moment until we get resources to rehabilitate and renovate it.
Dr. Kapua went further to state a number of reformations that the hospital has embarked on, ranging from the introduction of 15 solar lights to ensure security and visibility, establishment of hospital website, to creation of an ultra-modern burn unit for patients with severe burn situations. Deputy Minister of Health Dr. Charles Senesi applauded the hospital management for a demonstration of commitment to boost the health sector.
Well, this is really exemplary that you did this, and when you were selected as a hospital care manager, I knew what you did in Kenya, what you are going to do. For you to achieve this in Connaugh, this is where some of us grew our profession from scratch, and so I'm extremely happy. And this ward was always not the best of ward which we used to know, because this is where the surgical wards we used to have. So, but again, for you to single-handedly as management really to have achieved this is really worth it. Congratulations.
This ward is well furnished with 20 beds to accommodate patients. It is expected that with the opening of this newly refurbished ward, patients would be treated in a conducive atmosphere. For SLBC, Mohamed Kouma reporting.
The Ministry of Health, together with its partners including the Chinese Embassy and WHO, has launched a national hepatitis policy and strategy. The two documents are, among other things, aimed to reduce the incidence of viral hepatitis by 50% by 2030. Sori Ibrahim witnessed the launch at the Freetown City Council Auditorium and now reports.
On behalf of His Excellency the President's vision of human capital development, on behalf of the vision of the Minister of Health, that is a custodian of the health of this country, may I, with all dignity and honor, formally launch this very important document and the
The National Viral Hepatitis Policy 2023 and National Viral Hepatitis Strategic Plan 2024 to 2030 come with four lofty ambitions to strengthen health system capacity to deliver hepatitis services, enhance advocacy and social mobilization on hepatitis, reduce morbidity and mortality caused by hepatitis, and to reduce the incidence of viral hepatitis by 50% by 2030. The acting Minister of Health believed that the documents signal a new age on the significant challenges which he said have cast a shadow over public health. He was, however, optimistic that the policy and strategic plan have brought hope to eliminate the disease by 2030.
The National Viral Hepatitis Strategy and Policy is a culmination of rigorous work, extensive research, and collaborative efforts. It is a roadmap designed to guide us through the complexities of hepatitis prevention. At the primary level of prevention, preventing contact between the virus and the human being. Secondary level of prevention, those who are already infected, preventing them from getting ill. And the tertiary form of prevention, wherein we now try to rehabilitate and increase the quality of life.
The launch of the policy and strategic plan was praised by medical practitioners, WHO, Chinese Center for Disease Control and Chinese Embassy. Chinese Ambassador to Sierra Leone in his remarks noted that the documents were a step towards ensuring universal health coverage and consolidating human capital developments. In addition to their interventions in the health sector, Wang King assured that China would continue to support Sierra Leone in the fight against hepatitis.
Shoulder by shoulder, we fight against Ebola, fight against COVID-19. Now we are going to fight even harder against hepatitis, against cervical cancer and other diseases.
Hepatitis is a condition caused by inflammation of the tissue. Studies indicate that over 1 million people die from complications of viral hepatitis every year. The most common type in Sierra Leone is hepatitis B, with a prevalence of 13.8%. SLBC News Hour, Suri Ibrahim reporting.